Excellent, excellent. And just feel the whole spine opening up. Tuck these up first. Okay, so we have moderate scoliosis coming in through here. So medically, they will watch and wait, use medications until eventually maybe they have to do surgery. Sometimes they brace, depending on the practitioner. So what we're doing is a little more active approach to where we're actually going to be making specific adjustments to free up the brain so it can communicate with all the body parts, so it can balance better. And we have specific type of scoliosis protocols to rehab those areas. And the idea is to stop the curve, and sometimes we'll make improvements in reduction of the scoliosis. So let's go ahead and get started. So we come in here. It's thicker on this side. This is the apex. Good. She also has that kind of a gap of the sacrum right through here. So we're going to come in here. Rib cage is coming up a little bit over here, so we're going to bring the ribs back around. Good. Nice. We're going to do some drops right into the apex of the curve. Oh, nice. Nice motion there, huh?
Mm-hmm.
Turn to the other side.
Yeah, it was awesome.
Right there. Good. Excellent. Slide your back.
Okay.
A lot of times with scoliosis, you can have reverse curves, but she also has some degeneration at the C5, C6, and 6 and 7, and reverse curve there causes a lot of symptoms down in these wrists.
Mm-hmm.
So we have to check the carpal bones. There we go. So there's one there. Sometimes elbow. That's pretty good there. So we're going to check the other side. That's all right. Yeah, there's something here. Good. Now we're going to check her neck. So it's moving pretty well this way. So we're going to do a crane condyle lift to decompress those areas. We're going to come in here and excellent, excellent. And just feel the whole spine opening up. Excellent. And she does a great job relaxing. Very important. Beautiful. Excellent. Let's go face down.
Okay.
Good. So we like to warm them up. We do wobbling, do some traction, specific type of wobble exercises depending on which way we want the force in the curve, and we follow up with some rehab exercises. So scoliosis is not a watch and wait type of situation. You got to be active so you prevent progression of the scoliosis. All right.